So these are the list of the 7 levels which we check. Body, 3 doshas, sub-doshas as I mentioned. Each dosha is again divided into 5 doshas based on the elements. I have mentioned that dosha is a combination of element. Again it can be divided into 5 doshas, sub-doshas. So the total we get 15. And then organs, mahadhatus. We have discussed already about the dhatus, that is rasa, rakta, mamsa, majja, asti, medha, sukra. That is the food when we take, it gets nourished into the constituent elements. And finally it gets converted into ojas. That is one of the mahadhatu. Ojas, tejas and prana. These are the 3 main components which is present in every cell. They are the real immunity of the body. It is present in every cell. I will deal with it in a short while. And then through the mind pulse, we go with the emotional and the mental state, the negative emotions. Like if there is krodha in a person, then what is the range of the krodha more? Everyone has anger. Everyone has anger. As I say, it should be back to normal. That is important. To carry the anger, to carry that emotion burden and reflect it on our daily activities or on some other activity is an imbalance. So that is about negative emotions. Each emotion is again stored on or affects organs, like anger affects liver, fear affects kidneys, worry affects lung. So this is a simple example. These are connected in that way. Moods. There are majorly 7 kinds of moods: fear, uncertainty, lack of interest, loneliness, then oversensitive to external influences, despair and despondence, and last is overcare for welfare of others. This is also mentioned in the Bach flowers, but here these 7 moods are connected to again chakras. Okay, and then to the body, to the endocrine glands. So that is how we understand the moods. And finally Arishad Vargas, which I have already explained. As I have mentioned regarding the pulse diagnosis, to know it in an even detailed way, we almost may need another day to get it. So this is just an outline of what we are doing. Next, treatment. The journey from Prakruti, that is our own constitution, to Vikruti is disease, the journey of disease. Similarly, the journey of treatment should be from Vikruti to back to Prakruti. Just in a free rope, rope, when there is a knot formed, if we name it as a disease, in order to untie the knot, in order to untie it, we should take it back in the same way it has been formed. If we try to do it in another way, we may end up in another knot, which is not so advisable. So to unwind the way it has been started is the best way or friendly way to get back to the health. For that, it is very important to understand the path or the cascade of reactions that led to the disease. Symptoms are only the language or the final expression of the disease. Just like the fire alarm. When the fire alarm starts when it is active or it starts shouting, we think there is some fire, and we are alert, we are in the emergency situation, and we go and find where is the fire and try to extinguish the fire. Similarly, symptoms are just the sacred messengers which conveys to us that there is some problem in our body. It is important to elevate the symptom, but it is equally important to know what led to the symptom. So by extinguishing the fire is similar to understand the seat of the disease which led to the symptom. Seat of the diseases can be the dysfunction of organs and the organ systems. Next, after we extinguish this fire, we need to understand from where does this fire came and why did this happen. What we generally do is we try, either we break the alarm to have peace, or we extinguish the fire and we feel that the treatment is done. That is, we treat either directly the symptom, or we try to treat what led to the dysfunction. But equally important are the causative factors which led to the dysfunction. That means when a problem comes to us, we need to dive deep. We need to understand why this has happened. Here in our clinic, we try to understand the whole path of the disease. We do not only seek the temporary solution, but also try to understand the permanent root cause which led to the disease, the causative factors and the root cause which led to the imbalance. By correcting them slowly in accordance to the Prakriti, we can get back to our own state. That is swastha. Swastha. Swa is our own state. In Sanskrit, swastha is health. It is termed as health. So what they mean by swastha word is to be in align with our own state. So we should not only deal with the symptom, we should deal with the symptom, the seat of the dysfunction or the seat of the disease, then understand the causative factor which triggered this dysfunction, so that there is no repetition of it. We have the abscess, we cleared the abscess, we removed the whole infection, and we just leave the treatment, then it will repeat, because we have the ground for the disease to develop again. So it is important to clear the ground, and that happens only when we are realigned to ourselves. That is the main path which we follow. So we take care of the symptom, we take care of the seat of the function, the seat of the disease, the cause and the triggering factors which lead to disease, and the root cause of the disease. When we talk about the causative factors, am I clear till now, or do we need a break, or all fine? All good? So I can continue? Yes. So coming to the causative factors, it can be many. Generally, when we go to the medical doctors right now, they say this is genetic to you. Diabetes, do you have your father and mother? Yes, then it is genetic to you. Genetic is many things, but predisposition is very normal, because we are from our parents, we are from the genetic line. But what made it trigger is more important, and that is epigenetics. The environmental factors which trigger the gene to get activated is important. And in order to treat these type of diseases, we deal with the epigenetic factors. Nowadays, in these conditions, epigenetic factors play a very important role. It can be as in the form of food adulterations, the food toxins, or the radiation, the Wi-Fi, 3G, 4G, 5G. Everything affects our health. Everything makes us in the imbalance. All are the factors. But we cannot change the environment. Sometimes, maybe to some extent, but sometimes it's beyond our scope to completely clear the environment. Then what should be the solution? How to deal with the epigenetic factors? Any suggestions? Because you cannot remove the radiation from here. Then what would you do?
I love the radiation. No, serious. That's how I cure it.
Love and respect.
Love and respect it. And then it changes the effect on me.
Mm-hmm. Okay. So, what we believe in is to build our endurance. We cannot change the environment. What about the pollution?
Same thing.
Okay. So,
But I also take care of my environment.
Exactly.
why
So how you do it? That is the point.
Adapt only.
No, we adapt by increasing our endurance to the stress. We should never think to reduce the stress, or we should not, instead of working towards reducing the stress or reducing or changing the environment, along with that, it is equally important to increase our stress tolerance. That is what we call tolerance. It can be oral tolerance for food allergies, it can be emotional tolerance for the psychological issues, or it can be anything. So it is equally important for the patients or for us to be stress tolerant. When with the kids, we see that they should be brought up very carefully. They should not face any difficulties. Every parent has this in the mind. But what we feel strongly is they should be able to face any kind of problem. It is not that they should not face any problem. They should be ready to face any kind of problem without losing their state. That is the main essence. That is the real immunity which we want to explain in the best way. So similarly for the diseases, and for that, lifestyle and diet plays a very important role. By the diet, now the diet has a nutrition in diet is a very big subject in right now world. Some says we should have calorie free diet, some says we should have carbohydrates free, low carb, low fat, only protein. Based on what? Based on what we should decide all these things? I don't say this is wrong. I don't say that low carb is wrong. For whom the low carb is suitable, that is important. For whom high protein food is necessary. That is where the individualistic approach is needed. What are we? We need to understand that what is our function. For an athlete, protein diet is necessary. Protein first, because he has to have the muscles, he has to run faster, and then he need to have energy, then comes carb, and then comes the fat for him. For the mind workers, we need good fat, and then carb, and then comes the protein. When the mind worker starts taking good protein, he has problems. And when the person who is more want to be physical fit starts taking more fat, he has problems. So this depends on what our tattva is, what our essence is, what our constitution is. Based on that, we have to decide the diet and the nutrition. Lifestyle and nutrition plays a very important role in management of epigenetic diseases and triggering factors. We also explain to the patients that when we are treating a disease, some factors are towards the growth of the disease. Towards the disease, and some factors are towards the growth of our strength. We call it as Rogi Bala and Roga Bala. Roga means disease, the strength of the disease. Rogi is the one who is suffering from the disease. Just like yoga, yogi, this is Roga and Rogi. Rogi is the person who is suffering from that disease. Now, it is like a tug of war between the Rogi and the Rogi strength and the Roga strength. When the strength of the disease is high, it is difficult for the patient or the Rogi to overpower it.